Chairperson Dr. Mayanilla Selim, Anup Kinji, IAS Commissioner and Secretary, Health and Family Welfare Department, Marion Cross, Senior Health Specialist, World Bank, Jonko Onishi, Lead Social Protection Specialist, Program Leader, Human Development, World Bank Representative, Northeastern State, Ministry of Health and Family Welfare, Department of Economic Affairs, Government of Gujarat, Development Partners, Friends, and Academia, Civil Society, media friends, ladies and gentlemen. As soon as I heard about this interfacing meet organized by Health and Family Welfare Department, I accepted to be the special guest outrightly, without any hesitation. Why? Because among all the departments in the country or all over the world, the most important department is health and family welfare. Healthcare is most important. Education is for certain group of age, school education, college, university, for certain age of group. Sports, only for certain age of group, not for all ages. But healthcare is from oldest to the youngest. It covers every population. So we take it that this department is the most important department among all the functionaries department. So I think we should take it this important because it is for every section of people. Even the oldest man among the society, he don't want to die early till he breathes last, including disabled people, handicapped people. They don't want to die. So today, health conscious become very important for all over the world. So I take it is a very important interaction. It's a privilege to join you in Dimapur, now Chumukadima, for this important gathering on health financing reform for cross-state learning in the Northeast region. Your presence reflects a shared commitment to strengthen the foundation of health systems across the region, systems that are equitable, efficient, and resilient. The Northeast region, with its rich cultural and ecological diversity, is home to over 52 million people. Yet, despite its promise and potential, the region continues to face structural challenges that constrain growth and equitable development. The predominance of rural livelihood, difficult terrain, and limited connectivity make service delivery uniquely complex. These challenges are compounded by climate change, a reality that is already altering disease patterns, food systems, and disaster risks across the region. In health, these factors converge sharply. Maternal mortality remains unacceptably high. Childhood illness too often go untreated. And non-communicable diseases, cancers, and cardiovascular conditions are emerging as major causes of death. The health of our people is both reflection and a determinant of the region's social and economic well-being. Yet, it is equally important to acknowledge the remarkable progress achieved in the recent years. The Northeast has not stood still. It has innovated. In 2017, the Nagaland Health Project, supported by World Bank, broke new grounds by introducing result-based financing for the first time in the region, linking funds to performance, not input. Soon after, with support from World Bank, our neighboring state of Meghalaya, Mizoram, and Assam implemented the internal performance agreements, each adapting the model to local needs. At the same time, Nagaland and Mizoram have expanded social health insurance beyond targeted groups, moving towards universal health protection, a bold and progressive step that aligns squarely with India's vision for universal health coverage. Meanwhile, several Indian states, including Nagaland, have undertaken public finance management assessment to diagnose bottleneck in planning, budgeting, and expenditure reform that may not grab headlines, but which are essential for the long-term sustainability of health system. This workshop is about connecting these experiences, learning from one another's journey. Each state in the Northeast has taken different paths towards improving health financing and service delivery. Some have focused on insurance coverage and equity. Others on accountability and performance. And yet, others on strengthening governance and public financial system. We are also deeply honored by the presence of government of Gujarat, whose pioneering work in public financial management and health system governance offers valuable lessons for all of us in the Northeast. Their participation underscores the spirit of cross-state learning, where insight flow not only within the region, but across regions, enriching India's collective journey towards better health financing and service delivery. By bringing these stories together, we not only celebrate what worked, but also candidly examine what has not and the challenges of sustaining RBP, aligning incentives, or building institutional capacity to manage performance-based fund. Cross-state learning allows us to shorten and learning curve. It transforms individual experiments into collective progress. And it helps us identify scalable models that can be replicated, not just within the region, but across India and globally. As we convene over the next few days through panel discussion, technical sessions, and field visits, I hope we use this opportunity to identify what worked best in different contexts across the region, to strengthen collaboration between health, finance, and planning department, and chart a shared roadmap for scaling up reforms that move us closer to universal health coverage. I hope this workshop is not the end of a project cycle. It is the beginning of a new phase of cooperation, one where data, evidence, and dialogue drive policy. The road to universal health coverage in the Northeast may be long, but it is within reach if we continue to innovate, learn from one another, and invest in systems that place people, especially the most vulnerable, at the center. I commend the Department of Health and Family Welfare, Nagaland, the World Bank, and all participating states for making this interface possible. Let this forum be remembered as a moment when the Northeast came together, not just to discuss reforms, but to build a shared vision and a healthier, more resilient future. I wish all the participants to interact with each other, and the outcome will be successful for the region. Thank you, and God bless you.